I think what we really hoped for and what I hope we've seen are a number of things during this week. First of all, the opportunity to really focus on this problem in a way that we don't usually, to think about the needs of people living with mental illness around smoking and stopping smoking. I hope that people have got some more knowledge and awareness of certain issues that they might have been struggling with, things like vaping, for example, but other things too. I really hope that people have got some good ideas about what they're going to do locally around collaborating with other parts of the system and with patients and carers to really change the way we do smoking cessation for this group. And I really hope that people have had a really good week and are going away enthused and full of ideas to turn this problem around. I think on the one hand, smoking is an issue that we all think about day to day in our work with people with mental illness. On the other hand, we don't necessarily spend time really focusing on it and thinking about how we solve some of the really challenging problems, like how do we get support for people who struggle to engage with the support that's available usually? What's our role as mental health providers or people supporting individuals living with mental illness around smoking cessation, and how can we work locally with our partners in the wider system to make sure that we've got a really good offer of support for people who need it. So I would really hope that we've been able to move forward in our thinking about all of those areas. I hope that following this week, we've all got a really renewed focus and a shared view of what we want to happen moving forward, not just within our particular area or within our system, but as a whole region, so that we can guarantee that people in London, wherever they live, can access the support they need to stop smoking. And I think in the longer term, I would really like to see our quit rates and our health outcomes get better and better as the years go on. So I hope this is the start of a process like that, and I hope we can do it again in the future. If I've got one message for people to take forward, it's that people with mental illness deserve help to stop smoking. We're all in a position to make that happen, and my challenge is make it happen. I think we've looked at a lot of the resources that are available for people to stop smoking when they're living with a mental illness. But just to remind people of a few, we have support within our mental health trusts, your tobacco dependence leads and your physical health leads. We have our GPs, we have our community pharmacies, and we have our local stop smoking services. And we should all be working together to make sure that people with mental illness can access those, can get medication, nicotine replacement as they need it and in the way that suits them. We also have a lot of online support. The London Tobacco Alliance website has access to digital forms of support as well. So there is no excuse for not finding a way to help your patients or your loved one with stopping smoking, because we will do everything we can to tailor something to them. So my message, as I've probably said many times, is do it today. I've been interested for many years in improving the physical health of people with mental illness, and increasingly I feel like people with mental illness are subject to a really gross form of inequality. This is one of the examples of it, and I think we need to address that inequity that leads to much worse health outcomes, which people with mental illness deserve better. So I think about this as one of the ways we address inequity in our country, in our city, and I'm really pleased that we can move forward together in doing so.